Good afternoon, Dr. Camp and class. This is our Unit 13 video discussion. We have a 23-year-old female with a past medical history um, that presented to the emergency department with lower abdominal pain and vaginal discharge for the last 5 days. Uh, she does have um, suprapubic area with groin adenopathy, tenderness, but non-distended abdomen. So first, I'm going to start off by obtaining an informed consent for this patient. So I will start off with, hello, my name is Natalie Franco. I will be the nurse practitioner that will perform a gynecological exam in order to properly diagnose and treat your symptoms. This is a safe procedure that will be done right here. There are no risks associated with this exam, and you are free to decline if you'd like. However, if you don't allow me to do this gynecological exam, your symptoms will continue to deteriorate. And if my suspicions of pelvic inflammatory disease are correct, if treatment is delayed, PID will cause you worsened outcomes and long-term complications such as infertility and chronic pelvic pain. There is no alternative exam to this test for PID, but I can assure you I will make this fast and comfortable as possible. If you agree, is there a chaperone you would like in the room with you while I perform this exam? Next, I will be describing a step-by-step of this procedure. I will start off by asking you to remove all of your clothes from your waist down and cover yourself with a sheet. I will then have you lay on your back in this bed and place your feet on the stirrups so you are in the lithotomy position. Your buttocks will be at the edge of the bed so I can move the speculum easily and have better visualization. I will start the exam by first evaluating your outer genitalia, which includes the vulva, the labia, and the clitoris, and the urethra. It will then insert the speculum into your vagina after applying petroleum jelly. Once the speculum is properly positioned with the handle facing downward, I will open the speculum so that I can examine your cervix. I will examine your cervix for color, lesions, discharge blood, and examine whether the external os is open or closed. At this time, I will take a sample to send for testing, and I will then remove the speculum slowly, allowing myself to examine the vaginal wall for irregularities. Next, I will perform a bimanual exam so that I can examine the cervix, uterus, and ovaries. I will do this by lubricating my second and third fingers of my dominant hand and inserting them into your vagina while pressing down on your lower abdomen with my non-dominant hand. I will start off by examining your cervix and checking to see if your external os is open or closed. I will then push down on your lower abdomen to push your uterus down so that I can evaluate the size, shape, and position of your uterus. I will also palpate both ovaries to examine position, size, and shape, and this will conclude the gynecological exam. Next, I will interpret the urinalysis to include my differential diagnosis with reasoning. So the urine appears to be cloudy with 2 plus occult blood, 3 plus protein, 1 plus leukocyte esterase, 20 to 40 WBC, 10 to 20 RBC, and 6 to 10 squamous epithelial, and many bacteria present. This urinalysis result and symptoms point to pelvic inflammatory disease, also known as PID. Women with PID may present with lower abdominal or pelvic pain, vaginal discharge, dyspareunia, and abnormal vaginal bleeding. Risk factors include intercourse with multiple partners, age, previous history of PID, intrauterine device implantation, and tubal ligation. As PID is primarily a clinical diagnosis, a thorough history and physical exam is crucial. This is why the gynecological exam is so important because there is no diagnostic test. Next, I did my documentation for this, my procedure note for this procedure, which I included the name of the exam with the ICD code, the date, the indication, who performed the exam, that I did in fact get consent for this procedure, as well as a summary of what I did and the results. Um, what would be the diagnosis for this patient? As I explained before, my suspicions are that she has pelvic inflammatory disease. How would I create a safe, comfortable, and private environment for this patient? I would definitely provide this patient with a private room if the hospital, if it's allowed, throughout this process. It is very hard, especially as being so young and diagnosed with a disease that is considered a sexually transmitted disease. I have seen this firsthand, and it's devastating to the patient, especially at such a young age, not knowing what the long-term complications are, especially with PID, with chronic pelvic pain and infertility. So I would definitely build a rapport with this patient, help her feel comfortable throughout the process. And then for my two questions, I have what are treatment and management options for PID, and what are the complications associated with PID? Thank you so much and have a great day.